Trisomy 21 or Down syndrome is caused by the presence of an extra 21st chromosome. People having this disease show characteristics such as a much lower IQ, round face, shorter limbs, and sleep apnea. The chance of having a child with Down syndrome is about 1 in 733 births. The average lifespan for an adult is 55 years. Down syndrome was named after John Langdon Down, a physician who characterized the disability in 1862. Turner's disease, or gonadal dysgenesis, is caused by an absence of all or part of a sex chromosome. This disease causes non-working ovaries in females, webbed necks, a horseshoe-shaped kidney, and a short stature. People with this disease develop congenital heart disease, diabetes, as well as hearing and vision problems. Turner's takes on average 13 years from a person's life. Turner syndrome was named after Henry H. Turner, an endocrinologist who published his discovery in 1938. The average height of a female with Turner's disease is 4 foot 7 inches. Though there is no cure, growth hormone such as androgen has been approved by the Food and Drug Administration to improve height. Klinefelters or XXY syndrome is caused by the presence of an extra X chromosome in males. This disease causes small testes as well as reduced fertility in males. Klinefelters can lead to pulmonary disease and male breast cancer. Dr. Harry Klinefelter described this disease in 1942. This disease does not affect life expectancy. Cre-Du-Chat syndrome, also known as 5p- syndrome, is caused by a missing part of chromosome 5. This disease causes excessive drooling, hyperactivity, low birth weight, and cleft lip. The chromosome part is missing due to either de novo deletion or balanced translocation. Life expectancy is normal if no serious health issues are found. This disease is diagnosed by physical features and by genetic testing. It was first described in 1963 by Jerome Lejeune, a geneticist and pediatrician. The chances of this disease are between 1 in 20,000 and 1 in 50,000 births. Fragile X syndrome or Martin-Bell syndrome is caused by the expansion of the CGC sequence on the X chromosome. Since the sequence is abnormal, the protein needed for normal neurological development is not expressed. This leads to mental retardation, flat feet, and protruding ears. People with this syndrome have normal life expectancies unless serious health issues occur. This mutation happens in 1 in 3,600 males and 1 in 4,000 to 6,000 females. Although there is no cure, behavior therapy and special education can minimize its effects. Of the children with autism, 2 to 6% are caused by Fragile X. Lymphoma is a cancer of the lymphoid cells. This is caused by things such as environmental factors and immune system deficiencies that cause cells to divide with errors. This type of cancer results in anorexia, night sweats, and dyspnea, or shortness of breath. The first description of lymphoma was by Thomas-Holmes, a British physician. While there is no cure for lymphoma, patients with less aggressive types live almost normal lifespans. Lymphoma accounts for 5% of all cancer cases in the United States. According to the World Health Organization, there are 43 forms of lymphoma. Aggressive types of lymphoma are treated with both chemotherapy and radiotherapy. Sickle cell anemia is a codominant blood disorder which causes blood cells to form in a sickle shape. These blood cells are not able to carry much needed oxygen as efficiently as normal blood cells. The disease is caused by homozygosity for the mutation that causes the sickle hemoglobin to be present. The disease was named by Vernie Mason, a physician, in 1922. Sickle cell may lead to stroke, ulcers, and hemorrhaging of the eye causing blindness. 3/4 of all sickle cell cases occur in Africa. From 1979 to 1981, the U.S. Air Force required black applicants to be tested for the sickle trait before admission to the Air Force Academy. Bone marrow transplants have been proven to eliminate the sickle cell disease if done before adolescence. Cystic fibrosis is a disease that is caused by a mutation in the gene that controls mucus, sweat, and digestive juices. Cystic fibrosis is identified by scarring and cyst formation in the pancreas. This causes shortness of breath, sinus infections, and infertility. This disease was first identified in 1938 by Dorothy Hansen Anderson. The life expectancy for a child born with this disease went from 6 months in 1959 to 37 years in 2008. Antibiotics play a large role in helping the lungs of CF patients stay open and free from mucus. 97% of men are infertile but can still have children with medical reproductive assistance. In the United States, 1 in 4,000 children are born with cystic fibrosis. Tay Sachs disease is caused by a defect in the hexa gene on chromosome 15 that makes the enzyme hexosaminidase A. This enzyme is responsible for the breaking down of lipids in lysosomes. A simple blood test is used to identify Tay Sachs by measuring hexosaminidase A activity level. This disease results in blindness and deafness in children, or progressive neurological deterioration in adult cases. Warren Tay and Bernard Sachs identified this disease in 1881. Unfortunately, most children with infantile TSD, the most common form, die before the age of 4. Research is being done to use stem cells to replace the defective gene in patients. The chances of being a carrier for the TSD gene are 1 in 300. Huntington's disease is a degenerative disease that affects the nervous system. This causes the person to experience dementia and a decline in cognitive abilities. This disease is caused by a dominant mutation in the gene called Huntington. Most people show symptoms in their late 30s to 40s. Genetic testing can be used to indicate the presence of the disease even before symptoms arise. Life expectancy decreases to around 20 years after symptoms begin. George Huntington described this disease in 1872 at only 22 years old. The chances of inheriting this disease are about 1 in 20,000 births. 7.3% of people with Huntington's kill themselves by suicide due to the breakdown of the nervous system. Genetic testing can indicate the presence of the disease by a repeat in the HTT gene. Hemophilia A is a disorder that affects the clotting ability of blood and is the most common form of hemophilia. This disease is caused by the lack of clotting factor VIII. People with this disease experience bleeding for long amounts of time. Some people die from hemorrhaging of the brain and internal bleeding by a simple bruise if not treated properly. This disease was first described by Dr. John Conrad Otto in 1803. People with mild forms of hemophilia can use desmopressin, which is stored factor VIII, to reduce bleeding. Hemophilia is diagnosed by a blood test which measures levels of factor VIII in the blood. Approximately 1 in 5,000 males are affected with this disease.